Hi guys, it's Dr. Hardy, your pediatric obesity expert. Thank you for tuning in. Today, I'm going to be talking about allergies. I'm going to debunk some myths about allergies, and I'm going to give you some tips on how to make this allergy season a bit more bearable. So when we think about allergies, we think of like pollen, dust mites, cats, dogs, maybe even mold. What do you think those have in common? They are aeroallergens, meaning they are suspended in the air, we inhale them, and we get an allergic reaction from inhaling them. So let's dig in. Let's start with pollen. People who have allergies to pollen usually have allergic rhinitis, or they may have asthma that is triggered by the pollen. However, we don't want you stuck in the house all day avoiding pollen. You know, people who just avoid being outside during pollen season. They just stay in the house, have the AC on, and just avoid it, take their Claritin, in and out. You know, they go to school, they go to work, but they are not trying to be outside. The whole idea for this video is to let you know that you should not stop your life for pollen. You should be able to go outside, come inside, and live a regular life. And we'll talk about that more in this video. But first, I want to debunk a myth about pollen. The myth is that people think that they can only get an allergic reaction from pollen through inhaling it, like I said before. But people with atopic dermatitis, aka eczema, if their skin gets in contact with the pollen, it can trigger a reaction or worsen an already existing lesion. So, if you have eczema, you need to cover up that skin during pollen season because pollen will give you a flare-up.